Well, good day. This is Mark Ittleman, speech-language pathologist, and I hope you're doing wonderfully today. You know, we do videos to share with you, and we put them on YouTube, and we put them on our website at teachingoftalking.com. And in particular, this video today is going to be on common sense and common sense therapy for aphasia. And you might be saying, what do you mean, Mark? Why are you saying common sense approaches? Well, I'm saying common sense approaches because I think that there's a lot of approaches in the field today that are not very commonsensical. And so in some of the videos that I'll be doing, I'm going to identify some of them for you, so that should you come across any of them in your travels with speech pathologists, that you'll be able to handle yourself to make the right type of requests that you want for your loved one. So that's what this is all about, common sense approaches. So I want to tell you a little story about this morning. I was on a speech pathology website for speech pathologists who are in the medical type of area. And one of the therapists was writing about what she should do about reading and writing skills. And so she asked a question to the audience, and one speech pathologist said, well, you have to do a very in-depth assessment of reading, and you want to see how the comprehension is, and you want to see how the reading recognition is, and that's all fine and good. And I agreed with that 100%. But you know something? One little pet peeve that I have as a speech-language pathologist, and I've worked in many settings in the United States and in Florida and in Texas. And one of the things that I used to notice was that some of my colleagues would be working on activities like reading and writing. And I never really quite understood that. Here were patients who weren't talking at all, and they were working on reading and writing and cognitive exercises. But that's not why the patient came to speech therapy. Now, I guess I'm an old traditionalist in that I was trained that as a speech pathologist, I dealt with speech, speech correction, speech improvement, speech rehabilitation, that, I wasn't really so interested in reading and writing, although sometimes we have used reading and writing skills to supplement the speech therapy. But if you were to ask 99 out of 100 people who had trouble talking what they wanted to work on, I always found that in 99 out of 100 cases, it was the patients who wanted to speak better as their first priority. Now, I guess if you're an author and you don't do much talking, that an author might ask a speech pathologist to work on writing or reading skills. But that's really out of the ordinary. So when I'm talking common sense, I mean that if a person comes to you and they're not able to talk, then that's where you should put your first attention. That's where the therapist should be focused on figuring out the approach to helping the person with aphasia talk or communicate. I mean, that's what our job is. And what I'm seeing a lot of is therapists who are spending time on reading and writing, or they're singing, or things like that. And singing is not going to help a person per se really improve speaking. Now, I'm not saying that it's not a beneficial method, but not for talking. And don't let any singing therapist or music therapist ever tell you that their therapy is going to help you with a return of speech, because very, very rarely does that happen. Okay? So I'm talking common sense here. A music therapist deals with music. A speech pathologist is supposed to deal with speaking, deal with communicating, deal with interacting, deal with a relationship of two people where one person communicates something to the other person communicates something back, and the person with aphasia's job is to understand or to comprehend what they're hearing, like a question, and to be also able to verbally reply to the other person. So if you're dealing with a lot of these other areas like reading or writing or singing or any of that, then what's happening is you're watering down the therapy, the focus, the attention, okay, should be focused on one thing, I believe, to start anyway, until speech starts to recover. That's where the attention should be. And if you're, one of the mistakes I made as a therapist when I first got out in the field, I'd start working on their speech, and then their loved one would say to me, well, Mark, when are you going to work on writing? And I'd say, oh, yeah, well, we're going to work on that. And then maybe the next visit I started working on writing. But what happened is that the therapy got all watered down. That my focus got divided. And everybody knows that your focus, if you're going to achieve anything, needs to be in like a laser beam focus on what it is you want to achieve. And so another one of the commonsensical things that I want to share with you is that if you are coming for improved talking and they're working with you on your reading or your writing skills, no. Have a conversation. Look, we're bringing our loved one to you so that you can help them talk. Well, therapists might say, well, I think this is going to help them talk. No. Okay? One of the problems is that some therapists, they probably know how to teach reading or writing better than they do speech. So that's what they're doing. But it's very rare that if a person knows what they're doing with rehabilitation of aphasia, that they're going to prioritize what is going to be worked on in therapy. And I would hope that the priority is going to be on speaking. All right? So I hope I've made my point here. If you have aphasia, if you want speech to be recovered, then the care partner of the person with aphasia needs to be trained by a speech pathologist in how to stimulate speech in conversation, especially with the teaching of talking method. A lot of those old methods just don't work. The notebooks, the iPads, the flashcards, all of that. It's busy work. It's busy. They're busy, but they ain't talking much, and they're not going to be improving that much of their speaking. Now, I saw this one guy, he works with his iPad all the time, and he says all these phrases, he says all these words, but he's talking to the iPad. I never see him talk with another human being. And you know something? I never see much improvement either. If you're going to improve your talking, you must talk with someone. That's what talking is. It's not talking at something and saying things over and over again. That's not talking. That's just doing rote drill, which I wouldn't give you a nickel for. So, this is common sense approaches. This is one of them. If you want to work on your speech, you want better speech, find a therapist who's going to focus on your speech. And a therapist that's going to teach you what to do so that when you get home, you can continue to facilitate speech, words, phrases, sentences. This is Mark Ittleman, speech language pathologist, and I've been covering today common sense approaches to speech therapy for aphasia. But beneath this video here is a brief description of the video. Also within the description is information about our Facebook pages and about the website. Now, if you want to really learn about aphasia, and you must, if you are a loved one of a person with aphasia, you've got to get up to speed real fast. So come on over to the Teaching of Talking. We've got probably about 20 videos in there that you can watch that are going to tell you about the fundamentals of speech therapy. But if you really want to learn the specifics, okay, then you must learn the Teaching of Talking method, okay? And so get educated first about the general information around aphasia therapy. And if you want to speak to me, what I suggest you do is go to the website at teachingoftalking.com, fill out the box, fill out your name and email address and whatever else it asks you for, and then go onto the website, and you'll see at the bottom of each page are two small blue bars. One bar you click on and you fill that in to get the free videos and blogs every week. The other area down at the bottom of the page says survey and questionnaire. That you want to push and click on if you want to speak with me, if you want to consider having me mentor you. Okay? You know, people don't realize that speaking is probably one of the most important aspects of living. And people sometimes want to take the real easy way out. The easy way is not with an iPad, because it's just not going to do it. It just won't. And you'll figure that out after a while. I mean, the person you love might be busy doing that stuff, but they're not going to be interacting and talking. That's what you need if you're going to be able to have a return of speaking and talking in conversation. This is Mark Ittleman, speech language pathologist. Don't forget, click on the teachingoftalking.com underneath, go to the website, fill out the form, your name and your email address, and we'll send you lots of information every week. And also, if you want to speak with me, fill out the survey or questionnaire, and I'll help you. Okay? So have a great day. It's been a nice chat, and we'll see you soon. Bye-bye now.